Hi, everyone. My name is Svetlana. I work with Dr. Filonov for many years already. We're organizing regularly retreats in Montenegro with Dr. Filonov. And from time to time, we meet online, different patients, people that met Dr. Filonov. So we speak about dry fasting from different angles. Today, we have MD internal medicine with super specialty in diabetes. I think this theme is very important for those who have this disease and want and are interested in dry fasting. Dr. Kalpesh from Germany, who has Indian origins. Hello, hello. 7 years he lived and studied in Russia. That it's a big background for Dr. Kalpesh, and for us it's a big honor to have you here with us. I met Dr. Kalpesh at our retreat with Dr. Filonov in Montenegro last year. You were curious to meet in person Dr. Filonov and to learn his method by personal experience in dry fasting. That is outstanding to see how doctors of modern medicine are open-minded and available and curious to learn something new, something alternative, to widen their experience and knowledge. I really appreciate having you with us. So this was last year. And last month, as I know, you went to Russia, to Altai, to deepen your knowledge of dry fasting by observing Dr. Filonov's work with his patients. How was this experience? This was the first thing that I was curious to know.
So first of all, thank you so much for having me here. I really appreciate it, Svetlana. So you want to know my experience in Altai?
First of all, since I finished with this.
Well, what I can say, it was awesome. It was really, really interesting. And meanwhile, I lived in Russia, so I know Russian language and I know Russian culture and people. So it was not something new for me, but Altai itself was something new, very different. The energy from Altai is really fantastic. Like Dr. Filonov used to say, come to Altai and you'll see the difference. And he was right.
You will feel the difference.
Really, I was like totally disconnected from real world, and the nice people and the family of Dr. Filonov, the huge thank you. They were so nice, and they're in a lot of patient. They're taking care of the patient. And I was talking with everybody why they're coming here and what's their experience about disease. And it was really such a unique experience. So maybe I'll go next time. Maybe next year, we'll see. It was really awesome. So I can just recommend to visit Altai once in your life. The real Siberian experience.
Yeah. Thank you for sharing. It's something that I have as well in my heart. Let's start then. Can you?
All right. So as you introduced me, I'm Dr. Kalpesh Mansuria. I'm actually from India. I live in Germany like past 10 years. I'm MD of internal medicine, and I did 2 years before my diabetes in one of the best hospitals in Germany, by the way, in South Germany. And as I studied in Russia, so I can speak Russian. So that's why it was so easy to speak with Dr. Filonov and with you as well to get this new experience in fasting. So I was a newbie kind of before 2 years in fasting world. And after becoming an MD, I understood there's a lot of more to understand and to give the patient more than medicine. So there is a lot of hidden things we never learned. And I was curious about it. I was like, if you are hungry for knowledge, you'll get it. You ask the universe and you'll get it. So I'm so thankful. I had a chance last year to drive fast by myself as an experience, because I'm the doctor who applies on himself first and then tells the people, I mean, this is the right way. If I never did, I never know what is this. So this is my approach to it. Yeah.
Much
Yeah.
respect for your approach.
Sorry?
Much respect for your approach.
Thank you. I'm a student. You are remaining the whole life you are a student. If you are hungry for a knowledge, and this is a different new world, it opens a totally new, fantastic doors for the people who really wants to heal itself. Yeah. So as I'm a diabetes, as we are here to speak about diabetes, we will focus on this topic. Of course, there's a lot of disease. I'm MD medicine, so I have diagnosed a lot of cancers as well and a lot of chronic disease. But today in this meeting, we'll speak about diabetes. So, Svetlana, what question appears in your mind first you hear about diabetes?
First of all, yeah, definitely, it's very interesting to hear from you, having you with us in Montenegro. I'm really curious to see your vision on fasting and diabetes, because as for us, as for now, we try not to accept people who have diabetes for different reasons, and we will speak about that as well with you.
Yeah.
In any case, it's not that it's not possible to heal. We have some patients that we follow online that have diabetes, but since we have a big responsibility, huge responsibility for the group that is coming to us, for us it's important to keep everyone safe. So let's start from the very beginning. Maybe someone still doesn't have, or maybe doesn't know to have diabetes. Can you say what are the symptoms and what types of diabetes exist?
Of course. So we'll start from the basics. Diabetes means excessive sugar in your peripheral blood. So there's several type of diabetes. Most common is type 2 diabetes, is due to your lifestyle, first of all, and then genetics as well. So type 2 diabetes is worldwide the first diabetes, the maximum number of diabetes patients. But the second one, type 1 diabetes, is the most of the case, the young people, children as well. And as well, you can get first type of diabetes in your elder age, in your older age. It's called LADA, a late onset of diabetes mellitus in adults. So, of course, there's a diabetes in pregnancy, type 3. There's a diabetes after your pancreatic removal. There's if you're cancer in pancreatic surgeon, they are removing your pancreas, and then you are insulin dependent. There's genetical diabetes as well, type of MODY. So we'll not go over there. We'll just take in type 1 and type 2, the most common diabetes. And fasting, lifestyle. I mean, the lifestyle, it requires in both kind of diabetes in 1 and 2. But fasting, I will not suggest like we do, like dry fasting or water fasting in type 1 diabetes, because there's a difference. The definition of type 1 and type 2, I'm coming to this point. Type 1 diabetes, your pancreas, your beta cells, they don't produce at all any insulin. So you are insulin dependent on insulin shots. And type 2 diabetes, they have these cells. They are producing the insulin, but not enough, because these patients are, most of the case, they are insulin resistance. What is resistance? But to you, like if you eat like this portion of carbs, you need like this kind of insulin in normal person. But the patient with insulin resistant, he needs the same amount of the food, carbs, this much insulin every day. So it leads to insulin resistance. Diabetes is not diabetes on first day. It's a long process. Your lifestyle, you're getting insulin resistance, and then you're pre-diabetic, and then you have diabetes. So
Mhm.
Type
And
2
what are the
diabetes.
symptoms, the main symptoms, how a person can
Yeah.
notice or think of
Yeah.
about diabetes?
The most common symptoms, they are you are and you are losing the weight, you are polydipsy in medical term. That means you are thirsty, you are drinking a lot of water,
Mhm.
and you are going frequently to pee, so
Mm.
frequently urination. And some patient have some wounds, and they are not healing the wounds. They are coming to doctor, and there's a first kind of diabetes. Yeah, this is the most common. And what I've seen in the emergency in the hospitals, in the middle of the night, a young patient, like 20 years, 22 years, comes suddenly with a coma. So, and it's a for type 1 diabetes. They don't know anything. Sometimes they are ignoring the mild symptoms and they are going to coma, and they're coming to me in the emergency in the night. And then I see the sugar, oh, is like more than 600, and they don't know. So this is the first episode of the ketoacidosis. It's a ketoacidosis coma. So it's very depends. Type 1, type 2, the symptoms what I told you, it's most common, but it can represent directly in coma in type 1 diabetes.
Mhm.
And our topic, fasting and lifestyle. So my focus will be on type 2 diabetes. I won't suggest fasting, maybe interval fasting to type 1 diabetes because you are insulin dependent. So this is a
Mhm.
quite difference. Yeah.
How can I, from a person that maybe is not well aware of how to recognize diabetes, how often will you recommend to do tests and what kind of tests one can do to discover
Yeah.
either he has diabetes or not?
First of all, I will say if somebody has in your family, your mother, father, or your grandparents, diabetes or type 1 or type 2, whatever, then you I mean once the 2 year is fine to a certain age. So you don't need anything to do as you're a kid, as a child or you're a teenager, you don't need to do anything. Of course, there's a type 1 diabetes, and then it can occur in childhood as well, but you cannot it's like it's not a slow process like type 2. It's like sudden. It will happen sudden in few days to few weeks.
Mhm.
So we are focused on type 2 diabetes because it's a little confusing as we talk every topic, and I have to say type 1, type 2. So we focus on type 2. Your question will relate to type 2 in this
Okay.
video.
Mhm.
Um, so if you are genetical positive, like as I told, like parents or grandparents, and you are obese, and you are reaching like people in 20s. I had a teenager patient, like I'm 14 or 15 years old. He had a type 2 diabetes because he was really obese, 110 kg. So that's why he got. But normally it is okay if you check once a year, once or 2 year. HbA1c is a long-term uh, sugar. It shows like 3 months back your sugar. So it's a main thing. Otherwise, of course, it's urine test and your random blood sugar or your fasting blood sugar. So this is the methods. So there is no particular rule. It depends if you're genetical, if you're obese, it's your lifestyle, if you are tired, your symptoms. So this is I mean, once a 2 year is okay if you're fine.
Mhm. Thank you so much. From one side, I would love to say it's important to be aware, to know. From another side, I would love to say it's good not to know.
Yeah, yeah.
Not to try to find in your body what is not going well. Like, let's focus our attention primarily on our lifestyle and to maintain our bodies, our health, our mind in a healthy state instead of searching for a disease in your body.
Yep.
Like,
Yep.
search on
So listen to your body. I'm always saying, listen to your body. You should know your gut feelings and your body. If something wrong, figure it out. and go to your doctor, have some labs, but don't think I have to do. So if I don't nothing, I don't feel myself weak, I feel great energy, so I won't go to doctor. Why should me?
Like, don't be paranoid just in case. This is
So
not what we are.
hypochondrial is a term in medicine. Hypochondrial is thinking you have something wrong.
Yeah, this is already psychological problems. Okay, let's come back to diabetes too. What can be complications to other organs? Because diabetes is connected to pancreas. What can be complications to other organs?
So it starts, diabetes is a slow poison. Yeah. Diabetes is not diabetes. It often comes with a metabolic syndrome. So what is metabolic syndrome? It's like diabetes mellitus, blood pressure, your cholesterol, your fatty liver, so fat accumulation in your liver, and it's like a package. It comes. So one person cannot have only diabetes. Of course, first of all, diabetes or blood pressure, and then it leads to another or the third or fourth disease, heart attack, brain strokes. It's really complication. And I've seen my emergency, the patient, they didn't have any kind of pain, any kind of symptoms for heart attack, and they are getting heart attack right now, and we are doing a CPR because they had undiagnosed diabetes, and sugar leads to your nerve damage, so you cannot feel the pain like normal people feel the pain, so they're painless, a silent heart attack.
So this is kind of a side effect of diabetes too. It's not to feel
no,
pain.
it leads. I'm coming to the point. Your nose will damage. It's a poison for your nose, so you won't have any pain. You don't have any pain in your legs, in your chest as well. So there's another thing, retinopathy. That means eye problems. Yeah, it goes in your eyes, damages your eyes, damages your kidney. I've seen the patient; they are on dialysis. Kidney are not working. With diabetes type 1, of course, from the childhood, it needs a lot of years to develop that you are on the dialysis. So kidney damage, eye damage, nerve damage. If you have some operation or some wound, if you not heal on the time, so maybe you need antibiotics in hospital, it leads really to amputation in elder age. So we had a big hospital, and the one department was just for this amputated people or the chronic wounds on the legs. So this is a things, and diabetes comes with this metabolic syndrome. So 3 or 4 diseases together, as I said, blood pressure, cholesterol, and fatty liver as well.
Wow, impressive. What are the therapy options in the modern world right now for this disease?
Well, first, like what German Diabetes Society says for type 2 diabetes, if you diagnose first diabetes type 2, then try to fast, water fast.
Water fast.
This is official, water fast.
Official,
like
water fast, wow.
First step is recommended, like the professor told us that time.
How long? How long they went to water fast?
I mean, 1 week, at least 1 week. Ideally, it's 2 weeks, but 1 week. But nobody gonna do it. Believe me, maybe 1 or 2% people they're gonna do it. So, and after that, you check the parameters as well, and then you choose your therapy. This is the theory, but in practice, what we do is start tablets or whatever.
Are they healthy?
Very first or second days.
Are the medicines
metformin, the first drug of choice, and there is injections, GLP-1, glucagon like peptide 1 injection once a week. most of the case. So you will become more insulin sensitive, and there's a lot of functions of GLP-1 and metformin. We will go in this pharmacology section, and that will, of course, that will help initially. Of course, it's a drug. It's a different drug. So nowadays we have a lot of drugs. You can Jardians, for example, you lose in your urine the sugar. So it's beneficial, of course. But the point is, I will prescribe one drug, maybe second drug, maybe third drug after a few months or years, depends on the patient. But hey, you need to change your lifestyle. You need to change your approach to the
This is my
foods.
question. Is this recommended as a healing process, like changing of lifestyle, or it's optional?
No, change of lifestyle is, of course, not, it's not optional. It always advised.
Advised.
Yeah, advice. Change your lifestyle. Yeah, eat healthy, eat lower carbs, have high amount of protein, go in calorie minus, do something with your body, or yoga, or gym, or swimming, or hiking, cycling, whatever. Do something. So it's the result of a bad lifestyle. If we had a good lifestyle, we never go to diabetes type 2.
So, but is it possible to heal diabetes not by medicines, but only by changing the lifestyle? We're speaking about diabetes 2, type 2.
Well, good question. Good question. I would say yes. I would say yes. Therefore, you must have a strong willpower and a good doctor who says, hey, do this thing, don't do this thing. Look like this. Hey, just you have to get better in your lifestyle, do more exercise, eat well. This is not enough. Go deep. What is hunger? What is this thing? What is this thing? What is carbs? What is protein? What is calorie? What is calorie restriction? What is pancreas? What is everything? You have to speak with the patient. And normally we speak, but we don't have a lot of time every day.
Yes.
So it is spoken, but in the very little package. And most of the patients, they don't want to hear in reality. They want to prescribe the medicine and magic
Does the
pills,
magic
right?
pill exist?
So
Exactly. We prescribe
it's very
you.
sad part. It's really sad part. It's sometimes I don't feel comfortable to increase insulin more and more and more. I mean, we are prescribing insulin. And actually, it's not a good idea. This person has already on insulin, but it don't work in particular way it should be. So the patient has to break this insulin resistance. How we can break this thing? With fasting, with calorie minus, with a lot of physical activity to lower your stress, your sleep quality, your mental status, everything matters. But hey, how many percent of people they want to do this? Tell me.
Tell me one thing, since you are here and you
Yeah.
know perfectly well what is recommended, what daily new habits would you recommend to those with diabetes 2?
Well, listen to your body. All right.
Listen to your body. You can go to McDonald's every day because your body says to go to McDonald's. What do you mean? Listen to your body.
No, we are talking about healing journey, right? There's ups and downs every day. So you cannot have the same habit. You cannot do it. We are human beings. We are with a lot of emotions and hormones and chemicals ourselves. So it's up and downs. So if you are not really feeling good, you have to, of course, push yourself and motivate yourself. There's another topic. So I will say your question, I mean, daily habits, go for a walk. Simple. If you want cycling, do cycling. If you want swimming, do swimming. Do anything. Like at least 4 or 5 days a week. And there's a one enough reason to do it. There's a 1,000 reasons not to do it. It's about your choice. So you have to work on your willpower as well, on your mind, because your mind is a dog.
So it's about physical activity.
Yeah, it's about mental status.
Diet.
It's about mental status. So you have to practice something like meditation, like breathing techniques. This every available in YouTube. Do this thing, fix your mental stability and willpower. All right, and then go further.
Like
Yeah,
seems that
change.
it is very simple, like as if
It's very simple actually.
as if it is just the disbalance of the body. You just
Of
have to
course.
gather you together on mental,
Yeah,
physical, and
yeah, yeah.
emotional level, and
Of
that's
course.
all.
Of course,
Seems easy.
I've seen the patient. They are working in the office. They have really hard work, and they are coming to our hospital. And like we are doing actually nothing. We are providing the healthy food 3 times a day, and that's all. And I'm cutting insulin down and down and down and down. He's saying, "What is happening with me? Hey, stress level. How is work?
And
How is your life?"
sleep. How much
Yeah.
sleep affects your life?
Sleep is itself a medicine
Mm-hmm.
because you have to understand why. Because our body it works in circadian rhythm, right? Night is for the sleep, so your body can recover. So there's a lot of hormones produced in the night, in second half of your night, like cortisol is a stress hormone. If you are not sleeping or you have very disturbed sleeping, let me say, so your stress hormone will be up, and more stress hormone means more insulin, because insulin is a raw material for your stress hormone. So your insulin goes to manufacturing your stress hormone or other hormones because the raw material, and sugar will stay in your periphery blood. It will not go into your cells. So you have in the morning time high sugar level because your insulin is using for manufacturing your hormones. If you're a lot of stress, if you're not sleeping well, so your body is not relaxing actually. So insulin is basically an elephant in the room. It's a big hormone, the biggest hormone in the body. It's
Mm-hmm.
not the sugar to do. It's raw material for a lot of other hormones. And one more thing is really important. It's not about diabetes. Diabetes patient they can have a blood pressure and heart attack because the vessels, blood vessels, they're getting harder and harder day by day. And the cardiologist, this is a good cardiologist from USA. I'm a big fan of him. He told once after having a I'm practicing cardiology like 40 years, and after 40 years, I'm asking myself why people are getting blood pressure. We say in medicine, essential arterial hypertonia, lifestyle, etc., but actually, it's your insulin resistance. There's a studies in 60s and 70s from Dr. Kraft, I think. He studied like 45,000 of patients who don't have any diabetes. He checked about insulin sensitivity and resistance. And hey, the numbers 45 or 46% of people they were insulin resistance, and they lead to diabetes or blood pressure or heart attack in next 5 or 10 or 20 years.
Mm-hmm.
So as doctor says on the paper you don't have anything, that doesn't mean you don't have anything. So use your brain. We are doctors, we are healing the people as you get on the paper with one drug, second drug, and third drug. But hey, what we can do to prevent this thing or to reverse this thing? There should be a necessary of willpower of the patient, first of thing. And
Yes.
secondly, your doctor should be open for this thing and you have to think out of the box. This is the two mandatory things.
Seems very simple, but for many people, it's a hard lifetime work. I
Yeah.
understand this perfectly well. Yeah. Uh, so let's connect fasting and diabetes.
Fasting, yeah.
Yes. What do you think, by your opinion, how fasting can help people with diabetes type 2?
Type 2 diabetes, it can be reversed with fasting. It can be dry fasting, it can be water fasting, it can be interval fasting, it can be a homemade 1 meal a day. So you have to fix your insulin resistance. You have to break this pattern. So we'll not go to the deep how to do this thing, because I mean our session is not for this. If you'll fast proper way, of course you are on medications. You are on medications for diabetes, for blood pressure, for cholesterol, for maybe aspirin or whatever, insulin. So you cannot stop everything and fast to this step by step. You have to prepare your mind, your body, like your program, online programs is wonderful. It's very helpful. People should listen to these programs, how to prepare your body for fasting 1 month. And there's a lot of answered questions like I had also at that time, right? So you manage it really well. I must appreciate it. And first, prepare your body. You are preparing your body, you are preparing your mind as well. And if you're on medication, then you need a doctor in your preparation, in the fasting. And then most important, the exit. How you exit from the fast is really important. So you need a good doctor who knows, hey, this medication, you can reduce this medication, don't take it. And there's a one time, don't take anything and fast, but step by step. It's about
Yeah, it
medication
has to be
priority.
followed. Definitely have to be followed, and the doctor has to know what's happening with your body.
And it can happen. I will not say here, but it was a case in the night in 2 a.m. I had to wake up in our retreat and fix the problems. This one diabetic patient, type 1, all right. But it can lead to really a big problem anytime. So there should be a professional people who can help you, because you are not, you cannot think, you are not clear in your mind when you're fasting. So you need a professional people over there. So it can lead to hypoglycemia, it can lead to coma, it can lead to anything. So it's like not just like do fast and reverse diabetes. There's a lot of things. Somebody
And
with
diabetes type 2 also by fasting can lead to coma as well as diabetes type 1.
well, there's a difference. It's type 2, it says hyperosmolar coma in elder patient is mostly due to fluid. They are not drinking well, the old people, they are dehydration, or they have some infection in body and they don't know it yet. And if you're infection, you need a lot of fluid in your body. So it can lead to coma, but it's a different kind of coma, hyperosmolar coma, it says. Um, of course, you need to give a lot of fluids, IV, and of course, insulin slow by slow to lower the sugar. So it can lead to this coma as
What
well.
are
But
the risks?
different kind of.
Thank you so much. It's very interesting and important to hear to everyone who maybe has this problem or have relatives, beloved people with this problem, to know how to manage this disease, how to go on, what to think about, even related to fasting. What other risks exist if a person starts fasting without preparation, for example, without knowing how to, just jumping into fasting? I don't want people to do it just because we said that it can help. So what can be the risks?
The risk without a proper preparation. Well, see, it depends again on the whole package of the disease. With this package, patient is coming to you. If you had a heart disease, you had a stroke, you taking aspirin, yes, not, or which kind of medication. But the main common thing, it can lead to a very sudden dehydration. Of course, it's a dehydration if you're speaking about dry fasting. And I'm repeating for the people who's watching this, it's not mandatory to do always a dry fast. It's, of course, if you're not suitable, then go on a water fast. It decides a doctor and how long, or maybe combination of both of these. Yeah, it decides a doctor on your conditions actually. So it's very important to know your condition and your borders, and somebody has to be there. So dehydration, of course, it can lead to some intoxication, because if you're doing dry fast, So your own toxins, if there's no proper preparation, so you are absorbing your toxins from your gut. So gut preparation is really very interesting. Liver detox, because if you're the diabetes patient, they are having type 2 diabetes, they are having fatty liver, the fat accumulation in the liver. So you have to work on your liver. There are a lot of toxins in your liver, so you have to remove in proper preparation month. So if you are
At
not
least,
bad,
because good preparation, it's more than a month.
is the
I
key,
would
is the
say
golden
from,
key.
Hmm?
There's three stages, as you know: preparation,
Yeah.
fasting, and the exit, and the proper guidance from the people. This is really mandatory.
But just to underline that preparation, like quick one, it's 1 month, it's okay. But for people who have severe diseases, who really are ill, we would suggest to prepare themselves from 3 months up to 6 months.
Yeah.
1 month cannot be enough, because
Yeah.
we're speaking about
It's
long
everything individual.
In our mind, fasting is long fasting because we are dealing with long fasting practices. But to do that, you have to start with a short and to prepare your body, and it's from 3 up to 6 months. I want to just underline this thing because 1 month definitely
Correct.
to people who are taking a lot of medicines is not enough. That just
and the second thing, lots of people, they are saying, hey, interval fasting, I'm doing interval fasting, I'm doing great. I mean, it's really great. It's a really great start to interval fasting. It's a good thing. But hey, if we are talking about to reverse, we are talking about healing. So in any way, you need a long-term fast, either dry or water, depends on your condition, depends on your disease. You have to be a horse for a long race. And the interval fasting is like baby steps, like a kindergarten, I would say. So
thank you for mentioning it, because when people are speaking about intermittent fasting, I would say it's intermittent eating, because eating once a day, it's
calorie restriction.
intermittent eating. Intermittent fasting starts after 36 hours, 1 day and 1 night. It's intermittent fasting. Otherwise, it's intermittent eating. It's not something like a discovery, just a correct name of the processes. And it's good to do intermittent eating because it's
a healthy way to live.
Your body light and helps to detoxify detoxify your body. But I want to just because these things eating for me.
You're right. You're absolutely right, Svetlana. I mean, it's the wrong conception. Yeah, people. I used to give lectures in my hospital for people about blood pressure, about everything, like 1 or 2 hours once a week. And after the typical symptoms, what you can do, how you can manage the symptoms, everything about the knowledge of diabetes and blood pressure. People, you have to just take care about what you eat, because you are what you eat. In German, they say, "Du bist, was du isst." So you are basically who you are.
Everywhere in the world, you are what you
So
eat.
this is say in every language, I think. So be aware when you go to supermarket. There's a big mafia, the food industry. Hey, what are they providing in the supermarket is a catastrophe. You have to be smart. You have to be smart what you choose about your product. It's a small things. Choose your habits, choose your mindset, and you never be ill. I mean,
Kalpesh, one thing, coming back to intermittent eating. What you would recommend to start with? What kind of intermittent intake you would recommend to start?
Again,
it's like
about
baby
your
steps.
capacity.
We were speaking about baby steps. Let's start with this.
Again, it depends about the people, the willpower. I have a very good friend in Australia, and he never fasted, not interval eating, or what you say. And he was 110 kg, and I gave, he's my good friend, so I gave him advice like 3 days in a row. uh, about everything. And I told him, in your place, I will just start a water fasting, maybe 1 day, 2 day, 3 day. Or if you are not strong enough for beginning, just eat once a day, or mate, 1 meal a day is perfect way. At least two, but no snacking, nothing, no breakfast. It depends on the willpower again. And I gave him my best suggestion. And what happened? He fasted for 8 days in a row with night duties, with the baby, with everything. He did it. And after that, he became another person. So it depends on the willpower, either patient or persons um, who cannot skip the meals, who cannot skip the breakfast. So I have to play a small baby step. You are having your breakfast at 9 to at 10 to at 11. So 1 hour baby steps. It again depends on the individual person, how they're
It's very
strong.
good
What
advice. If you have a breakfast at 9, try to do it at 10. Simple.
10. So the people, this really, really hard, and they cannot believe you can live without your breakfast. And breakfast was the time from some particular country. It was a big propaganda. We didn't go into this topic, but I mean, it depends on person. One can skip the breakfast, can skip the evening meal. One can have 1 meal a day, or do like 36 hours a week, and rest days have 2 meals. It's really different programs, and it all depends on the person, how far he wanna go, how much he wanna heal himself.
How in reality he want to heal himself, because
Yeah,
there
so I
are
gave
a
a
lot
two example, right, of my friend, and the second time he did 11 days. Can you imagine that? And then, yeah, I introduced him dry fast. Now he prepare for dry fast, and he did it for 110 to 86. Amazing work.
Wow.
And the
Because
small, the last tip: if you do something like that, don't share it with anybody, with your surrounding, with your own doctor, maybe some doctors or some relatives or your friends circle. They will demotivate you because there's ignorance, lot of ignorance over there. So just listen to yourself, use your brain, and do it. Don't speak until you are done. This is my tip for the people.
this what I did when I did 7 days of dry fasting. I didn't tell to anyone because I was not sure if I can do it. So why to
Yeah,
share if I'm not sure?
of course.
What do you think about, maybe my last question to you,
It's okay. It's fine.
about the psychological aspect? I see a lot of people who claim to want to heal, but I see as well in them, I may be mistaken as well, I see in them like excuses first, and then they like the process of healing, but not really desire to heal. Kind of, because
Yeah.
process of healing can be different. Even taking pills, they think that they are healing. They are doing whatever they can. So there are people that sabotaging being healed because they like the process
Look,
of healing themselves.
yeah, I got your question. Um, Look how we rise. We are children, we are in the school time, we are in university, and now we have become something. How the things nowadays works, what you hear from your childhood, what people does in your family, in your school, in your friend circle. So what you see, you believe. It becomes a truth for you. And if you say, like people, you and me or Dr. Filonov, hey, you can do the things differently, or many of the people, the smart people, they won't believe you in the first time. They are always skeptical because the reality became a truth for these people. To change this reality, you have to change your unconscious mind. You have to change the pattern. You have to change the approach. So again, you have to work on your mind first if you want to change something. And the people are smart enough, really, then they will listen to you, do some own research, and they will say, all right, I'll give you a chance.
I
As I
would
came to Montenegro, I just read his book because I had a lot of questions. What happens with your kidney? What happens with your potassium and sodium and whatever, what you're like as a doctor. So I, wow, it can be really dangerous, I thought. And then I read his book and I used some, all right, just give it a chance. Just go there. And after that, make your own opinion. Maybe I'll say it's bullshit, or I'll say, all right, this I'm thankful for this experience. So you have to just get into the process, get done, and after that, make your own review, make your own opinion.
And I would add to everything said, to ask yourself why you want to heal. What's next?
What's next?
What are your ideas of life? What are your desires?
Yeah.
What are your dreams? What is after that?
Yeah.
And if you know why you want to heal, it's much easier to understand your motivation.
Yeah. Yeah.
Otherwise,
So,
with no motivation just to heal, like happy life, it's very vague idea.
yeah.
What exactly you want to be healed for? Exactly.
How you want to use your happy life?
Yes.
For what your purpose?
I
Fantastic.
would ask everyone who are right now with us, watching us, and is ill, to ask yourself this question: why you want to heal?
Why?
Without vague ideas, very precise. Just to put down 10
and write it.
goals.
Write it on the paper. You have to write. Really, it's like NLP. How was NLP? Yeah, you have to just write your dreams, your goal, why you started in this journey.
Be happy wife, be happy woman, be happy
it's so
man.
very superficial.
It's not an answer. It's not an answer. Be healthy, it's not an answer. Why you have why you want
exactly.
health.
Really brilliant, Svetlana.
So the
I'm really
responsibility.
impressed how you think. I'm really impressed how you think. And we spoke a lot of times, different topics, and really you are doing great. And I hope someday the people will be more and more and more aware of all the things. Thanks to social media, thanks to YouTube and everything, like we are giving our message, we are receiving the message, we are learning, and everybody is a student whole life. So
Everyone.
keep open to yourself to learn something new and spread good things, do good, think good. That's my message.
Thank you for your message. The responsibility to change our lifestyle or our lives is totally on us.
Of course.
Each of you.
Sure. If you want to change anything in your life, start with the man in the mirror. That's all. Don't listen to anyone. This is my last message. Thank you so much, Svetlana, having me here.
Thank you.
If I can be helpful to anybody, so let me know.
We will leave some links that will lead to you in case someone wants to speak with you. I will be happy to share. Thank you, everyone.
I'll be more than happy. Thank you. Namaste.
Namaste.